My name is Dr. Stephanie Smith. I'm a pediatrician. I went to UVA for undergrad medical school and was at VCU. I opened this practice, FocusMD, because my goal is to really promote self-awareness for children and young adults for mental health in the community. For children, their self-esteem is linked to how well they do in school. When they do really well in school, they enjoy going to school and they become productive members of society. However, when they don't do well in school, they become disruptive. They don't do well in school, they flunk out. They really have a bad influence in what we try to do every day. So it's not really their fault. They're not being bad kids per se. They really have a problem keeping up with what's going on in class. And by treating their ADHD, I can help them in that respect. What makes our office different is that I don't do, as a medical doctor, I can do medication, but that's not all that I do. I look at sleeping, I look at diet, I look at the household, and because everything together is what makes a good child, what makes a good treatment strategy. You can do medication, but without the lifestyle changes, it really won't work. And that's what makes our office different, because we look at both of them at the same time. Me having ADHD myself, I kind of know what it's like to be on both sides of the fence. I know what it's like to be told, you can't do it. Maybe you should try something else. You need to try harder. Focus, pay attention. And I know that these kids are really doing the best that they can. However, but they need some help. And I think that by providing that help to these kids, they can become successful. So that's what the goal of the office is, to try to help these children. Especially now that the new healthcare laws are changing and mental health is being recognized more and more, to see how well that impacts these people every single day. So with that new law, I'm hoping to take advantage of this, and now's the time to act. Small business is critical in the community. Because for me, especially being in a small office, I can take time with my patients. I get to know them. I know when my patients get an A on their report card. I know when someone's pregnant. I know when little brother is acting out in class. I know all of this because I have that relationship with my patients. You have to have someone that you can rely on, someone that you feel comfortable with. And I feel that having a small business, you can do that.